Hi, future professionals. This is Bethany. We are going to go over a chemical peel with the beautiful Jessa. We all know who she is. Gorgeous. So I already did a double cleanse on her. We did the Clear Cell Salicylic Acid from Image. The reason I used this particular one twice is because it's a great cleanser to get makeup off and excess oil without stripping the skin. And then the second cleanse will be to actually cleanse her skin after. So I kind of use the salicylic cleanser to act as kind of my degreaser for the chemical peel. So if you look closely at her skin, which you can't see through the camera as well, but I'm just gonna kind of describe to you what I'm seeing. We've got a little bit of pigmentation up here just from previous acne breakouts. It's the red pigmentation. And then we've got a couple scarring. We've got one scabbing right here, actually. Mainly the red pigmentation. And this is actually really treatable. What we're going to do to start off is, now that she's cleansed and her skin's ready to go, I'm just going to go through and extract what I can. And that way, when we put the peel on, it'll absorb right into the acne spots and it'll just kill all that bacteria. And hopefully heal up some of these pigmentation spots that she has. It's kind of random over here. Mainly it's going to be, most of the pigmentations are on her chin, a little bit through here, and a few up here. These feel kind of like there's something underneath a little bit, but not too much. So that's what we're going to start off with. So we're going to use our extraction tool and a piece of gauze to wipe off the excess goodies that we get. Hopefully we'll get some good ones. Now, with people who need extractions done, you need to be sure that you're applying with the extraction tool evenly around the whole area. We don't want to go in like this, okay? We don't want to go in like this. We want to go in this, okay? You see the difference there? So when I go in like this, I can maybe do a slight twist like this to get a little bit more aggressive with it if I need to. She doesn't have too much to get. I'm just gonna go through and see what I can get out. Yes, that was a good one. I really wish you guys could see this. It's delicious. Delicious? Maybe that's not the right word. Extractions are a huge part of dealing with people who have scarring or pigmentation, or they're breaking out in general. The whole point of that chemical peel is to purge their skin, get all of that stuff to the surface, so then we can extract it, get rid of it, keep that process going, keep the sloughing off of the skin cells going, and then eventually she's going to run out of stuff that needs to come out, and that's where her skin will start to become more normal. I sometimes get dyslexia. I don't know if you guys have noticed that. Just got a few. Just gonna lightly run through here really quick. The nose is just painful. Not everybody needs extractions before a chemical peel. Most people do, especially if they don't necessarily have acne breakouts around the perimeter of their skin. They might have some blackheads here that you can clear out, especially if they're trying to shrink their pores. You want to make sure to get all the crud out of their pores through here and then kill all that bacteria in there, and that's what shrinks the pores back down. We got to get the stuff out first. Not too much through here. She's kind of at that phase where she's healed up pretty good. She doesn't have a lot to extract. That's a good place to be. Yeah, Yeah, it's already. Okay. So now that we've done our extractions, we're gonna go ahead and do the chemical peel. The peel I chose for her is the Acne Lift. This has glycolic and salicylic acid combined, so we are going to have to remove it after the 5 minutes of leaving that on. And I also picked a Enhance dropper. This one is the Retinol. So we're going to get her tingling today. Sorry, there's a flake, I gotta pick it. Okay, there we go. I'm probably gonna add 1 dropper full of this to the chemical peel. Okay. I'm gonna push this down so you can see here. Okay, so that should be about enough that you need. Sorry, my hand's like over your face. This is totally unprofessional what I'm doing. You never want to reach over your client's face, but since we're doing this video, I want you guys to see exactly what I'm doing. Okay, so I got a full dropper full of this. I'm just gonna squeeze that all in there. And that is ready to go. If you want, let's see. I'm gonna use the clean end of this. I'm just gonna mix this in really quickly. So we want the retinol to kind of disperse equally throughout the entire chemical peel, throughout the Acne Lift peel. Okay. So I'm gonna take my gauze and I'm gonna saturate this completely. What you wanna look for when starting a chemical peel is, okay, where is the most issues? Where are the issues the most prevalent? So right through here, her jawline has the most red pigment, so we want to work through here, and this is where she's breaking out the most. So I'm gonna start over on this side of her jaw, and I'm gonna work my way directly across through here, okay? So I'm just gonna do 1 pass through here. And I want to press pretty firmly. I want the peel to absorb really, really well. I'm gonna go back in and dab just a little bit more. Cheek number 1. Dab a little bit more. Cheek number 2. Whatever process, or over the lip, sorry, 1 second. Whatever process you decide to apply it, you want to do it the same way every single time. Okay, so I did cheek 1, cheek 2, and I'm going to do the nose. Do you feel anything?
Mostly just in the open spots.
Okay. And then last but not least, her forehead. So I'm going to start just through the middle here and then go to the sides. There we go. That looks good. Okay, can you get your timer ready for me? So I'm gonna wait maybe like 30 seconds to a minute before I reapply. If they're not feeling anything, I think it's fine to go back in and apply another layer. Thank you, yes. We just need to make sure that we're watching the coloration of her skin. So pink and red is okay, but if it starts to turn a light purple color, we need to think about taking that off. So it looks like she's doing pretty good. She's not feeling very much right now, are you?
Just some like little itchy spots.
Little itchy spots? Okay, so we're gonna go back over where we started. Left side of the jaw, all the way across the chin to the right side. Breathe, dab in. Cheek number 1. And cheek number 2. Over the lip. Nose. And forehead. Okay, so she should be feeling a little bit more. How you feeling so far?
Good. It's tingly.
Okay, so what we need to do now, go ahead and set the timer, perfect. So So give me 20 seconds. Let me know when 20 seconds is up. So we're setting the timer for 20 to 30 seconds to kind of give her skin some time to react, see how, if it gets worse or less or whatever. In that meantime, we need to make sure, again, to watch the coloration. So most people get more red like around their cheeks, middle of their forehead, their chin, and their nose. It's hard to get down here, you know, to get reactive because we've got a lot of adipose tissue there. Okay, so on a scale of 1 to 10, Jessa, how is your skin feeling?
Like
1 being nothing, 4 being, yeah, 4 being like, it's too much, take it off.
Oh, like 2?
Or 1 to 5, yeah. 2?
3, maybe?
3? Okay, so we're at a 3.
5.
Okay, so she's at a 3, so she's actually at a perfect spot, but since I like to go a little bit more, I'm going to do 1 more layer, and then we're gonna leave that layer on for 5 minutes. So turn your head that way. So we're gonna, again, repeat the process. Firm pressure all the way through. Jawline. Cheek number 1. Cheek number 2. Upper lip. Nose. And then we're going to go right into her forehead. Okay, that's perfect. Okay, 5 minutes for me. So we're going to leave this on for 5 minutes. The recommended time to start off a new client for this one is 1 to 3 minutes. And then you can slowly work the time up to 5 minutes. I wouldn't maybe recommend this peel on a first-time client, but if they've got some major acne and they need to get going and they've had treatments before and their home care is perfect, you might as well. So what we're going to do now is I'm just going to go in and kind of push this, just a light massage, push this into where she's having issues, especially on the chin here. I really want to kind of stimulate it a little bit more because she's just a little bit pink in some areas. I want to get her lower cheeks a little bit more. Are you still at a 3?
Mm-hmm.
Okay.
That feels good because you're helping scratch the itches.
Right? This helps scratch the itch. They like it. Never thought about that before. It's kind of cool. Okay, so this is what that massage looks like. If they're starting to get pretty red, maybe stop the massage. And also, with the excess that's left over on your gauze, you can also do 1 pass on the neck. We want all of this to age the same. I don't know if you've ever seen those people that have really young looking faces and then you see their necks and you're like, oh, you forgot your neck, girl. No. It's really sad actually because most of those women put scarves on and they're really embarrassed by it. So we definitely don't want to do that to our clients. Okay, so I'm going to pause the video. Or not pause the video. Yeah, I'm actually going to pause the video and I'm going to come back when the 5 minutes is up. That way you don't have to sit here and watch me massage her. Not that it's not fun, you know. Be back in a minute. Oh. All right, we're back. The 5 minutes are over. So what we're going to do is we're going to take a cooler towel that we left outside of the towel warmer. We're going to put this directly onto her skin. It'll be a nice, very cooling feeling for her. I hope my nails aren't purple in the video. I did some purple shampoo last night and now my nails are stained. Now everyone's looking at my nails. Another way to neutralize a chemical peel is to use a baking soda solution. I like to do 2 tablespoons water with a teaspoon of baking soda. You don't need a lot. But water has a little bit of alkaline stuff in it, so that's why it can work. But like we talked about today in class, sometimes people's skin just hold on to that chemical peel and water's not enough. They need a neutralizer. Sorry, I got your ear again. She recently re-pierced her ears and I keep touching the ears. Hopefully she'll forgive me. Probably. You have to, right? I'm your teacher. Is that cooling down pretty good?
Yeah, still like my upper lip and
your
nose
upper lip?
crevices,
Okay.
but everything else is.
So she's still feeling it in her upper lip, on her upper lip, and her nose crevices. So we're going to go back in with the sponges and make sure that there's zero activity. We don't want this pill to keep going. And I don't like to squeeze all the water out of the sponges. I like them to be pretty damp. Almost when you press down, the water kind of comes out of the sponges. That's up to you though, however you want to do that. So I'm gonna fold these in half like that, and I'm gonna go right through where she's feeling it. Really get the water to kind of come out onto those areas. Okay, so we're gonna pause. How does it feel now? Do you feel any activity anywhere?
I don't think so.
Good. Okay, so when they feel nothing, go over one more time with the sponges. This is just what I like to do, just to double check. Sometimes your clients will lie to you. There we go. That should be feeling pretty good. So the after effects immediately, the skin's gonna feel warm, maybe a little bit tight, firm. I actually like that feeling quite a bit, like right before it peels. I think that's a great feeling. I love that. Okay, so we're gonna now put on her aftercare. This is the moment for you guys to educate your client on what they need to put on afterwards. For chemical peels or any treatment really, it's not gonna work as well if their home care stinks. That's just the basic fact about it. This is what you need to explain to them in a professional manner. So with clean hands, you want to go ahead and put on your serums. Serums are absolutely necessary. They are kind of a way to make the skincare routine a little bit more individualized. We can give anybody mostly, generic moisturizers, that are professionally made, but serums make them a little bit more, individualized for this person. So I'm gonna mix two together. I want her to have some healing ingredients and also some brightening agents. So I chose the Vital C hydrating facial oil to help kind of repair the skin tissues, get the hydration back and all that good stuff. And then we've got the balancing antioxidant serum from the Ormetic line. This is awesome after a chemical peel. This balances the pH level and it's gonna help calm everything down. And again, don't do this over your clients. So I'm gonna move over here. I love mixing two serums together. I think it's a great combination. And you can combine a lot of different things. Okay, so evenly dispersed through the hands. If they've done a pretty exciting peel, make sure you're gentle with this part. After you've evenly dispersed it, you want to make sure to go back and press the product into the skin like that. It kind of helps to reinforce and push it into the skin further. Don't forget their chest, don't forget their necks. Look how pretty that looks. Okay. And now we're going to do the Ormetic Eye Lift Gel. You need just a tiny bit of this. Is it not opened yet? It might not be. It's a new one. Let me reopen this really quick. Nice and fresh out of the bottle.
Woo.
Like it. All right, so I like to just put that on the back of my hand there. You can keep your eyes closed if you want. There you go. I like to use my thumbs usually to apply, just because I feel like it's not only relaxing, but my thumb curve just kind of fits inside this eye orbital area. I really like that. And that way I'm not hurting my wrist by turning like this. Both are fine. It's whatever you want to do. Okay, the next thing we're gonna do, I'm gonna add some of the Intense Brightening Cream. Now some of you are like, oh, that's too much for after a peel. No, it is not. It is a great one for after a peel. It is just gentle enough to be able to go on right immediately after. This is going to help that red pigmentation that she has. My dyslexia is out of hand today. Just ignore it. I do. This might tingle a little bit. Does that tingle at all? Okay, she doesn't even feel it. So now that we've slept all that dead skin cells off, this is going to now brighten the pigmentation. So that's exactly what we're looking for. We want to get rid of the redness. Put the rest on the tops of your hands, because we can. And then last but certainly not least, we need to put on the sunscreen. If you do anything, it has to be this step. I touched her ears again. Sorry.
That's okay.
Okay, that looks amazing. Okay, and you're gonna finish off with some lip balm, which I forgot, but don't forget that with your client. And she's all done. Okay, this is a good time. Educate your client on when they need to come back next. We can make a whole other video on series and how often they need to be coming in. But for Jessa, if she was a client of mine, I would recommend that we start her with a series of maybe 6 chemical peels and have her come in once a week for those. And that's gonna reset everything. And I would do the Acne Lift over and over and over again, just to kind of purge her skin and use the glycolic to also help with any premature aging and help with lightening these reddened spots that she's got going on. So I hope this was helpful for you guys. See you next time. Bye.